Hello, good evening, everybody, and welcome to our Tech Tuesday, our Technical Tuesday, where I take a little bit of a deeper dive into the ins and outs of nutrition and some of the things that, some of the common causes that we have where we don't have the correct nutrition and how nutrition helps us under certain conditions. And this past couple of sessions, we've been covering that the dreaded big C word, which is not COVID anymore, but cancer. And it's always been referred to as the big C. And yes, it's a scary thing, but it doesn't have to be that scary. And over the last couple of weeks, please feel free to go back to the recordings of this. Subscribe to my YouTube channel. You will get all these recordings automatically sent to you then. But go back and just pick up what I've gone through over what is cancer, how is it spread, how does it work, is the fact that you just pronounce the word cancer now deadly, but what is it, what causes it? And now we're going to get into how we can, I wouldn't say treat it, but support our body to treat itself and to protect itself, not just against contracting cancer, but once you've got it, to help to strengthen your body to overcome a lot of the issues, because cancer itself is, to simplify it, it's a cell that's gone rogue. It's a normal cell. It's a normal cell that we've got. Our body is made up of trillions of cells, and it is simply one or more of those cells that goes rogue. And one of the things I likened it to is a mass shooting. Fortunately, we don't seem to have too many of those in this country, but overseas we quite often get them or hear about them. And it's a normal human being who goes rogue and he starts killing people. And a cancer cell is exactly the same thing. It's a normal cell. Something triggers it, just like a mass shooter or a mass murderer. Something triggers them and they go on this killing spree. So we need to be able to protect ourselves and try and stop those cells from being triggered and going rogue. And there's a few ways of doing that. So I've covered a lot of it already as to the causes and all the rest. So we're going to continue on over here while I just share my screen quickly. Just hide all my bits and pieces. Takes me out of the way as well. And right. So the scary big C, which doesn't always need to be scary. Sorry, got a little bit carried away over there. So I'm just going to quickly recap. ACA is the American Cancer Association. And last week we covered some of the costs of cancer and how expensive it can be, not just in life, but also in other costs of treatment, which are horrendously expensive, costs for your family, emotionally, physically. You go into hospital, there's costs over there. There's the cost of the medical aid. There's the cost of the treatment, which are horrendous in the case of chemotherapy and even radiation. It is an extremely expensive thing. So if we can prevent it or protect it and shorten those treatments, we're going to save quite a bit of money. And the ACA has recommended things like expanding public coverage by removing the Medicaid eligibility categories and raising the income threshold. Now, these are overseas goodies, but you can liken it to this country as well. And they want to allow all non-elderly, non-disabled citizens and legal US residents with family incomes below 133% of the federal poverty level, or about $30,000 per year for a family of 4, to be eligible for Medicaid benefits, which is, Medicaid is like NHI or NHS. That's the public medical treatment. And they want to extend coverage to low-income childless adults, providing them with access to preventive care such as colon and breast cancer screenings. Remember, I covered last week as well that if you have regular screenings and you can detect this cancer in the early stages, it's a lot easier to treat it and to overcome it long term. It's the same as the story of how do you uproot an acorn tree? How do you uproot an oak tree? You pull it out when it's, where's my picture? When it's this big. If you pull out a seedling of an oak tree, it's a lot easier to pull it out than when that tree is your height or above. The same thing happens with screenings. It's anticipated that more people with cancer can be diagnosed and treated at an earlier stage, thus increasing their chance for survival. So what is effective cancer prevention? As we've covered over the last year or two with all conditions, prevention is a lot cheaper, easier, and less painful than cure. If you can prevent an issue, you are on a good wicket. So one of the things we can reduce the risk by, some of these things are very common and very basically common knowledge, but easy to do or easy to say, not always easy to do. But we need to avoid tobacco. We need to limit alcohol use. We need to limit exposure to ultraviolet rays from the sun in tanning beds. Tanning beds especially are lethal things. We need to eat a diet rich in fruits and vegetables. We need to maintain a healthy weight. And we need to be physically active. And that doesn't mean signing up to a gym and going to do the next Ironman competition. It means parking 10 parking bays further away from the entrance to the shopping mall and walking. And I've got patients who literally go to the mall to walk, and they power walk up and down the mall a few times because for them, it's the safest place for them to walk. They get nervous about going out into some areas, and this is sad but true. A lot of the outdoor areas these days, unless you're going in a group, is not safe to walk alone. So they can be physically active in their local shopping center. You need to seek regular medical care, and just having a regular physical, even if you go to a local clinic, check your pulse, check your BP, check your temperature, and check spots on your skin. You can go to your local hospice or your local cancer organizations. And if you've got, say, a mole that looks suspicious, let them check it. In most cases, that's free. Sometimes they require a deposit or a donation, should I say. And they'll monitor it and they'll advise you. There's apps on your phone that you can get that you can check your moles, because they look at different things like color, change of size, etc. There's a whole different lot of things that you can check. So you don't have to go and see your doctor if you don't have medical aid, but get regular medical checkups and regular care. Go for screenings. You know if you are at risk. If there's a family history of certain things like cervical, breast, and colorectal cancers, it's important to be screened for those regularly, at least once a year. If in doubt, more than that. Be aware, and as I always say to people, listen to your body. Remember, we did the series on Jim McAfee's book called Your Body's Sign Language. If you haven't seen that, it's one of my earlier series. And if you want to, order the book. It's not locally available, unfortunately, but you can get it off Amazon, who will ship it out. And it's worth the investment because it's a fascinating book where he teaches you to listen to your body and all the little signs that become symptoms to bigger things later on. And now this is possibly a bit of a contentious issue. but vaccines for the HPV and hepatitis B. Some guidelines for the early detection of cancer. First thing is breast cancer. A yearly mammogram starting at the age of 40 and continuing for as long as a woman is in good health. And if you are nervous about mammograms, there are other ways, other screening options available these days, including a simple, regular massage where you can check yourself for little lumps that could possibly be something bigger. And if you do pick up something that's not looking right, you generally will understand what that is. Then you can go for a mammogram if necessary. A clinical breast exam about every 3 years for women in their 20s and 30s, and every year for women 40 and over. Now remember, breast cancer is not exclusive to women. Men get it as well. And I think the most famous person who really brought this to the fore was Tom Cruise, who was diagnosed with breast cancer a number of years ago. And if you know Tom Cruise, well, it doesn't seem to have slowed him down too much. Breast self-exam is an option for women starting in their 20s. Colorectal cancer and polyps, beginning at age 50, both men and women should follow one of these testing schedules. Tests that find polyps and cancer, and this usually involves swallowing a camera. Some of those tests are a flexible sigmoidoscopy every 5 years. It's not a pleasant thing. It's not fun, but can be done in theater, can be done in a doctor's room. And if you think swallowing the camera is unpleasant, I can tell you that the colorectal cancer is significantly more unpleasant. Do a colonoscopy every 10 years. You can do a double contrast barium enema every 5 years. Trust me, these tests and examinations are not pleasant and not fun, but as I said, to check and see of what you don't want is significantly easier. A CT colonography or virtual colonoscopy every 5 years. That one's probably a little bit more user-friendly and pleasant to go through because it just involves lying in a CT scanner. Some tests that primarily find cancer: a yearly fecal occult blood test. So what they do is it's a little bit gross, but they do a yearly test on your fecal matter, and then they can also do a blood test as well to check and see, is there any sign of bleeding in your gut or not? There's another yearly fecal immunochemical test that can be done every year. Aren't you glad that you're not a medical technologist? Because they're the guys that get to do these fun tests. A stool DNA test. So those are just some of the things. If in doubt, these are the tests that your doctor will request. If you know that you have a family history of these things, these are the tests that you need to look for and go for fairly regularly. Lung cancer is another one. So if you meet all of the following criteria, you might be a candidate for screening. Now, if you're in peak health and there's no funny signs or symptoms and there's no history of cancer in your family at all, then probably don't need to do these screenings quite as often, in my opinion. However, if in doubt, be tested. So you need to be in the 55 to 74 year age bracket, in fairly good health. So you might think that you're fit and healthy. If you have a history of at least a 30-pack smoking history and are either still smoking or have quit smoking within the last 15 years, you are at risk. And I'm going to bring this one up again because my late brother-in-law, I'm sure he'll forgive me for using him as an example, never smoked in his life. lived up at Orreby, which, for those of you who know the South Coast, that is farming area. However, and he was a maintenance manager on a campsite. But he had a very sweet tooth. Farms are notorious for spraying all sorts of chemicals all over the place. And he was involved in changing the roofing on the kitchen dining hall area. And that was loaded with asbestos. And I do believe that some of the paint that was donated to the campsite was lead-based as well. So he didn't need to smoke to be exposed to these sorts of things. Lung cancer was the very, 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 very last thing that any of us even thought that could be the issue, but turned out to be a fatal issue. So these are some guidelines, but look into other backgrounds, look into your environment, because there might be something that can trigger it. Prostate cancer. Starting at age 50, men should talk to a doctor about the pros and cons of testing so they can decide if testing is the right choice for them. Now, when I was working in the oncology units, I was told that, and I can't remember the exact age group, but if they test men, I think it's over the age of 80, there's an almost 100% probability that they will detect prostate cancer. So if you're planning as a man to live to 120, you are probably going to be diagnosed with prostate cancer. However, it can be an extremely slow growing cancer. So it might only start causing problems when you turn 150, in which case, as Don Lawson used to say, who cares? Because you won't be around to worry about it. But be aware. So if you are an African American or have a father or brother who had prostate cancer before the age of 65, men should have this talk with a doctor starting at age 45, not 50. And they have been bringing that age limit down quite a bit over the years. If men decide to be tested, they should have the PSA blood test with or without that other nasty exam that one often sees being joked about, but is a very serious thing. Fortunately, these days, the PSA blood test, which is a prostate-specific antigen test, that's what those letters stand for, is a lot more pleasant and a lot more accurate than the other exam that nobody really enjoys. How often they are tested will depend on their PSA level. And again, I'm not quite sure of the exact figures, but your PSA level should be in the region of about 2 to 3. Your doctor will start getting excited if your PSA level is between 5 and 10. With full-blown prostate cancer, your PSA levels could be in the region of 400 to 600, to put it into perspective. That is trouble with a capital T, and you don't want to be in that level. So we're going to get into, I'm going to start this. I'm not going to get very far, but I'm going to start this. How does cancer and nutrition work? And this is information that I've gleaned from newsletters written by Dr. Jim McAfee, who, for those who don't know him, is a clinical nutritionist based in the States. And he wrote the book, Your Body Sign Language, and he has a website called imageawareness.com, where you will see a lot of these newsletters dating back from the 1990s right the way through to today. He publishes a newsletter every 4 months, I think it is, every 3 months, because he does 4 a year. So if you want the website, please let me know. I'll send you the link to the website. It's there, it's freely available. And I've taken some of the highlights out of some of his newsletters for this next section. According to Gerald Dermer, or according to Jim McAfee, Gerald Dermer was one of the first to observe that there was an alteration in the cell membrane of cancer cells, which contributed to their ability to move about. The membranes of cancer cells lose glycoproteins, or proteins to which sugars are attached. Remember, cancer loves sugar. So if the sugar has been taken off the protein, it's going to go look for the sugar. And that's how it moves around. The fewer the glycoproteins in the cancer cell membrane, the more aggressive cancer tended to be. Cancers arise when the process of development of a cell is hindered by nutrient deficits or the introduction of carcinogens. Those are your triggers. So anything that is carcinogenic is basically meaning cancer causing. A good deal of evidence supports the notion, it's telling me I'm running out of time, that the development of cancer is an epigenetic phenomenon rather than a change of the DNA of cancer cells. In other words, genes are switched on or off, but are not added or destroyed. Dermer writes, cancer is a result of a breakdown in the signaling mechanisms that control the orderly activity of genes in developing cells. One thing should be obvious from this description of cancer. Adequacy of nutrition for normal, healthy development of rapidly growing cells is essential for the prevention of cancer. Similarly, avoidance of toxic exposures which compromise normal development is important. I'll just cover this very briefly. A large number of population-based studies have shown that individuals who consume 5 or more servings of fruits and vegetables have about half the risk of developing a wide variety of cancers. This raises the question of which fruits and vegetables are most cancer preventative and why. Anti-cancer fruits and vegetables work their magic by virtue of phytonutrients, which are chemicals produced by plants. A number of plant compounds inhibit cancer cell growth, and some may actually kill cancer cells. The protective effects of fruits and vegetables against cancer is based upon several different mechanisms. Firstly, they enhance the elimination of carcinogens from the body. Secondly, they may inhibit inflammatory activity in the body. And thirdly, they may interfere with the activity of cancer cells as they seek to establish a blood supply for themselves. And fourthly, they may prevent the attachment of carcinogens to the DNA. Finally, they may have a direct toxic effect on cancer cells. The complexity of the actions of phytochemicals suggests that the overall benefit of these compounds will be a result of the synergistic effects of a variety of different compounds and the overall quantities of these substances found in the diet. Many of the most effective anti-cancer compounds in fruits and vegetables are bitter, acrid, or astringent. Food producers have gone out of their way to remove these compounds from foods because consumers do not seek them out, so they're not profitable. Thus, selective breeding and debittering processes have greatly reduced the exposure of the average individual to plant-sourced anti-cancer compounds. Many of these compounds have long been viewed as plant-based toxins. The most commonly consumed vegetables in the Western diet, including potatoes, carrots, lettuce, and tomato, had little effect on the proliferation of cancer cells in the study conducted by Boyven. One notable exception was the inhibition of prostate cancer cell growth by tomatoes. These vegetables account for 60% of the total vegetable intake in the US. Almost 1/3 of vegetable intake in the United States is in the form of potatoes, and half of this potato intake is in the form of French fries. And that's where I'm going to quit for this week because we only have a couple of minutes left. So before I stop recording, does anybody have any questions or comments?